Call the meeting to order, do the salute to the flag. Dave, would you like to lead us?
Which Dave? I pledge allegiance
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, liberty, and justice for all.
Okay, moment of silence. Okay. Welcome, everybody, to the February meeting of Nassau County REMAC. Thank you all for coming. We checked and we do have a quorum, so we're good to do business. This will be my first meeting as chair, so please bear with me. If you have any suggestions along the way, let me know. So first off, just to look at the minutes, they were sent out yesterday to approve the minutes from the December meeting. Any questions about the minutes? Need a motion to accept? Dr. Hassett, Dr. Mulbauer? Any opposed? Okay. All right. Incoming correspondence. We have the Bureau of EMS. They have any actions? Don, any Bureau of EMS actions? We're going to check if there's any actions. Dr. Yeah. Okay. We will. We'll check on that. I'll read that into the minutes if there are any on the website. We did have a question about e-bridge utilization that we're looking into that was brought to us, so we're going to follow up on that. Dr. Silver and I are going to follow up on that. We did get notification that Floral Park Center Fire Department 130 went out of service on December 31st, and we work with the state and with the fire commission, wherever the chair where's Tom? Where'd Tom go? On the back, Tom Devaney, we work with Remsco. Sorry, brain part. We work with Remsco and handle that with the state. What the regulatory stuff we had to handle, so that was taken care of. And then there has been a couple of different agencies that we've gotten report from New York State EMS that were having issues with their controlled substance licenses or forms for their renewal, and we're working out those issues with the Bureau of EMS and providing support to those agencies with questions that they have. For outgoing, we put the requests out for the medical director forms and the regional survey completion. That's what we do every year. So every year on January 31st, those forms, the annual survey and the medical director forms are due. We confirmed, Don and I have confirmed that either they're all completed or all in process, and we've talked to everybody. So again, we have compliance. Yeah, we have 100% compliance with that again, which is great. And we appreciate that. And it's super important for all of us to have that information so we know each year who we're going to work with. So we do appreciate everyone participating on that. And then our outgoing request for monthly data from online medical control, and we're working on getting that data. All right, so for reports, do you have a question? Oh, I'm sorry, the Bureau of EMS.
Yeah, so REMAC last met in December. So since then, there's 4 enforcement actions. Henry Marino, EMT number 538468, certification surrendered for violations of Part 815A3 and 816A1. Anthony DeLucia, EMT number 453174, certification revoked and assessed a civil penalty of $8,000 for violations of Part 800.3 A and M, 800.3 AL, and 815A2. 2 more to go. Roswell Sano, EMT number 463218, suspended for 1 year and assessed a civil penalty of $2,000 for violations of Part 815B1. And Raheem Austin, EMT number 479837, certification revoked and assessed a civil penalty of $2,000 for violations of 800.3 AM and 803 AP1. So if you don't know where to look those up, let me know.
Thank you, Doc. All right, for chairman report, I do not have much for today other than to say thank you for everyone for the support and for electing me to be the chair this year and next. I am very much looking forward to working with everybody. Really would like to continue on the path that we're on. We're doing a really good job. We've gotten a lot more people engaged. We really want to work with each agency and medical directors to try to do more education and just to support the system and continue to grow. I think a really good base of what we've been working on, and I think moving forward, I'm really excited about what we're gonna be accomplishing. So, it's very important for everyone out there. If you have any concerns or questions or suggestions and you want to talk to us, please reach out. We really want to be the voice and the support and the guider of education for all from this body. So please don't hesitate ever to reach out if you have any questions or you need help with training or education. And we appreciate you all being here. Vice Chair.
Actually, first, Vice Chair, okay, I was gonna go give my CMAC report. So, CMAC met in December, we're meeting again at the end of February. I'll let Don talk about for SEMSCO stuff. Medical standards had meetings before CMAC, and some motions were made for the committee, including a discussion on supraglottic airway policy. The discussion on supraglottic airway policy basically referred everything to the region and the agency. And there's actually a state form that the agency has to fill out, and then that gets pushed out to the region. There was a discussion on blood implementation. They're hoping to come up with additional regulations in 2026, and they're going to be putting out something for comment. There was Dr. Dorsett does a lot with data, clinical data, and they have a data clinical integrity committee or tags. So she's working on how to get accurate data when a question is asked. And she looked at she reported out what they're doing in the Milrems region, reported out what they're doing in California. New York State has biospatial, which they're sharing with the regions, hopefully soon. That's been a process, been ongoing for years. The pace will pick up a little bit. With regards to interfacility transport, they created an SCT tag or specialty care transport. That's been ongoing. We had a meeting with that committee today, talking about best practices, looking at the New York City regional interfacility transport, and then trying to go backwards. So this way we don't have to keep rebuilding a bridge, knowing that the interfacility transport is governed under federal EMTALA regulations, not just the EMS regulations, and the EMS providers are really following orders set from the sending physician and the receiving doctor. So let's see, what else? Thanks. Sorry. RSI was looked at. There's five regions in the state looking at policies and coming up with best practices that are going to report out at the state meeting. That includes Nassau, Suffolk. Proposed collaborative updates and discussions were had. The proposed protocol changes are coming up for a vote in February, which is what we do every year. We make the changes throughout the year. February, we vote on them and then become the new protocols on July 1st. So if you guys have anything for me to bring up based on the current protocol set, please let me know now, because we're voting on it in 2 weeks.
Is there anything new? Significant?
They have I think they have something for OB. There's
Right.
There's they're considering Pitocin, I believe.
So for new OB protocols, so one of the things was OB was separated out to follow ACOG guidelines, which is American College of Obstetrics and Gynecology, sorting out eclampsia and hemorrhagic shock, and they talked about adding blood products and TXA to the protocol, as well as oxytocin. Pain management was added ibuprofen and Tylenol for BLS, IV acetaminophen at the AEMT level, ondansetron, ODT for nausea and vomiting, push dose vasopressors for hypotension and RSI. Olanzapine for agitation was moved to standing order and dosing adjusted for older adults. A default vasopressor drip in bradycardia was moved to epinephrine, not norepinephrine. They discussed training and educate. They said that has to be discussed training and education as well, to make sure that there's consistent education across the state. There was discussion about pediatric asthma, wheezing, and then make the EMT level mirror that for anaphylaxis. And then They talk about IM injections for anaphylaxis at the EMT level, but with check and eject. And so that may come as a change in the protocols as well. That's really the significant stuff. And when you log in and you look at the protocols, there's actually a change log.
Right.
They're very transparent about everything that they're looking to change.
All the new stuff is on the.
All the new stuff is on the
Okay.
change log.
Thank
The corrections, everything, it's all listed. The other thing that was presented was, LifeNet Air Medical, they said we're gonna present our protocols. It was reaffirmed at the CMAC that because they're a HEMS agency, they don't have to get their protocols approved, but they are submitting them for state approval anyway. And then Ivy-Kepra, Nassau County and Suffolk County are supporting a pilot project for Ivy-Kepra for status epilepticus. And so there was a lot of discussion about that, the minimal dosing, and it's gonna, I guess, be brought up again at this February meeting. There was EMS for children discussion. They talked about how 50 hospitals part of the Always Ready for Children program, and they're trying to get every emergency room to be ready for that. But that also means the EMS agencies should be ready for that. We need to train and have proper pediatric equipment. We have to keep looking and drilling on our pediatric protocols and our pediatric skills. It may not be a large number or volume of our calls, but we don't want the pucker factor to go up. I enunciated that correctly, right? We don't want people to get too nervous or worried when they're dealing with children. We want them to be able to be competent and skilled. And that's gonna save lives. So please make sure as medical directors and agency leaders that you're doing drills with peds. One of the other thing that's going on with pediatrics is they're talking about procedural comfort. So there was a lot of discussion about medication for procedures in kids, making sure we're doing the right thing. Under old business for the CMAC, there's a discussion about bylaws. That was this bylaw issue was resolved, and it's going up to the state for approval. It means it goes to the State Bureau of Legal Affairs, which I don't know if there's anybody there, and then the Commissioner of Health, and then it comes back down and gets approved. So the bylaws had a couple of issues where they were out of compliance with state regulations, and now they are in compliance. Surgeon is being added to the New York State CMAC. We've asked over and over again about a state EMS medical director. This has been an ongoing discussion for years, not just a year, but years. First, we were told it would be a part-time job, and it was posted, but it never was. Then we were told that they're looking into it. Then they're told that they're hiring 250 other people for the Bureau, which they've completed those hirings, and now they're gonna start working on it. And then when we asked again, they said, we're still working on it. So it seems like this is an opinion here, not fact. It seems like they're just really not interested in getting a state EMS medical director. Let's see, medical director forms for New York State Department of Health forms. Please make sure that you complete them. There's going to be a little bit of a change to those agency medical director forms because they were missing a line that included the agency physician and all the agency physician demographics. When the agency was recredentialing, that was sort of an oopsie, so they're fixing those. So when you're recredentialing, make sure you have the most current forms. There's also discussion about public access defibrillation programs, and that the public access law doesn't include semi-automatic defibrillation wording. So that was sent back to the legislative committee for update so that it brings it into the 21st century, because right now it's an archaic law that needs to be upgraded. The other thing was for Physician of the Year, Doug Isaacs was one, and Dave Violante, who was the chairman of the SEMSCO, was recognized for his IGL work and pre-hospital research, 24th and 25th, and that's New York State CMAC. And Don, do you have SEMSCO? Okay. Let me know. All right. Questions? Got all that?
Okay, I did forget something under incoming. We received notice from NYU EMS that they're changing their medical director from Dr. Bohm to Dr. Simon, and we'll work with NYU to get all the paperwork taken care of. Sorry, I didn't mention that under incoming. So. Yes, all right. CMAC report's done. QAQI, Dave.
I promise to be a lot shorter than that. So just a couple things. There were some people asking about membership in the QAQI committee. The plan has always been to try to keep the physician and non-physician members equal. So right now, the balance is there. There are a number of non-physician members non-physician people interested in joining. So if you're a physician and interested, please offer to join us. Again, I say this every time, we've changed the focus of QAQI. We are not looking to be punitive in any way, shape, or form. When we look at directors, it is always from the lens of, is this a regional problem? Is there something that we're learning here that will help other medical directors and other agencies? If the answer is no, and it's a provider level issue, we refer that back to the medical director. We did not have a meeting last week because of the conference in Florida, so we're going to be scheduling one the next couple of weeks so we don't miss too much time. And there's two topics that are going to be coming up. One relates to EMTALA, and the other one is going to revolve around cardiac arrest and how we're doing here in the county, based on how many people we are transporting that end up expiring in the hospital versus going to the hospital and being resuscitated.
As opposed to staying on scene.
As opposed to dying at home.
Right.
Yes. We're looking at what percentage, because obviously the protocols are encouraging stay on scene and resuscitate, not to transport non-viable. We're going to take a look and see if that's actually happening in the county with regard to best practice.
Perfect. That's a good.
I yield back my time.
All right. Thank you, Dr. Silver. All right. RSI Airway is B. We had a very good meeting of the Airway Committee prior to this meeting. I wholeheartedly agree with Dr. Silver. We've been talking the aligning the way we do our operations in Airway for quality assurance reviews and for education being basically mirroring what we're doing in QAQI, because the two agencies cover a lot of the same ground. And also technically our committees, our Airway is a subcommittee of QAQI. So we're just going to continue working together. We had a couple motions that under new business to go forward on. One is for a new EMS agency to be approved for RSI. That's Hicksville with Dr. Zito. That comes as a seconded motion from Airway, so we'll do that in new business. We also have a couple new providers that were put forward and voted on. Sal Farrow from Belmore Merrick EMS, Bo Grafero, Jeremy Bernstein, Gabby Grafeo, Mike Kirkish, and Jelena Tran from New Hyde Park. Gabby Grafeo, we just had to do finish off some documentation, but we're going to put that together as a package as long as Gabby Grafeo's documentation is completed out. So we'll put that as a seconded motion under new business. And then also under new business, there's 4 agencies that are interested in being BOS iGel agencies. I'm sorry, supraglottic airway agencies. It was the pilot, just burned in my brain. South Farmingdale, North Belmore, Hewlett Fire Department, and Syosset Fire Department. So that also will come as a seconded motion to do under new business. And then just the other stuff that we chatted about in the meeting, we did some case reviews. They all looked good. We are reiterating education-wise that when intubating, it's super important to watch for hypotension because both the medications given, any vagal response you get from doing the intubation, plus switching to positive pressure ventilation, all can cause hypotension. So we just want to make sure to put it out there for an educational piece that whether you're doing an RSI or an MFI or standard intubation with person with a pulse, to constantly be watching to make sure they're not bradycardic or hypotensive and treat appropriate with fluids or pressors or whatever the protocol allows for your level. The other thing we talked about was trying to capture more data on MFIs because the airway form, we think we're probably missing some of that self-reported data. So Dr. Silver and I are going to work on some ideas for that. We'll bring that forward. And then there was also discussion about transfer of care at the hospital, making sure that if someone's intubated, that the confirmation happens that the tube is good before you move the patient. It could be, so we're going to have like a little mini tag put a couple folk together and get some best practices on how best to, get that information to the hospital and transfer care, so we know that the tube doesn't get dislodged, and we can confirm that. So, we're gonna work on that for the next 2 months and then bring that back to our next airway committee, and then hopefully have, like an action document that we could look at for the next, REMAC. We just, again, it's a patient safety. We want to make sure we're doing the right thing and we're offering the best recommendations for everybody. And for the BLS iGel, just understand that any agency that wasn't part of the pilot that now wants to come on board, there's a whole policy from the state and also in our policy manual about the steps to take, including what your training program is going to be and which supraglottic airway you're going to use. And we're just going to monitor that and coordinate that with the medical directors to make sure that that all runs smoothly. And that should be it for airway. Any questions? All right, protocol subcommittee, Dr. Ryan.
Yeah, yeah, we did not have any meeting because there's no items on the agenda, so, no report.
Okay. Credentials subcommittee, Dr. Kugler.
All right, so annually, we have that medical director form and agency form. We have 100% compliance, which was reported out in opening of the meeting, which is fantastic with the agency medical director form. The other half of that is the data analytics online annual survey, meaning we need to know what resources your agency has so that we can work as a system, not as a hodgepodge of EMS agencies. So please make sure that your agency fills that out. Right now, it looks like everybody is working on it or has completed, which is fantastic. So please continue to encourage your agencies to get that data to us. And if you have any changes, forward that information to the REMSCO or the REMAC so we could update our records. There's been no requests for any additional medical directors or except for NYU, and no requests for field physicians. So that's all I have.
Thank you, Dr. Kugler. Policy subcommittee, I don't think Dr. Vermonti's here. Have a report on that. Okay, no report. RTAC, Don?
They have.
Okay, yeah, I think that's end of this month.
Yeah.
Yeah, that's end of this month. Okay. All right, communications tag, Dr. Kugler's excused. Do you have anything for communications?
Yeah, I do.
Okay.
So
The other Dr. Kugler to give that report?
So the handsomer Dr. Kugler is a way of business, so I send his apologies. He is always reporting on eBridge usage. Last year, the total use of eBridge, all the eBridge notifications was 58,889 notifications. So people say we're not using it. I would say we're using it quite a lot, and that doesn't include the phone calls and the other parts of the eBridge that are used, including the airway form and things like that. So that's a significant usage, given that we have 150,000 EMS runs in the county on average. Again, we don't really know, but that's it. It's at least a third of all EMS runs in the county. So that's fantastic. I don't have the non-eBridge data to report out at this meeting. It was requested, and hopefully we'll get it for you guys for the next meeting. On the significant calls to date, there were 22 video calls year to date. Of the 5,945 notifications, 5,437 of them were these ALS/BLS calls. That means we've only had approximately 500 critically ill or minor calls in the region. I'm pretty sure we've had a lot of sick patients. So as a provider, please, or tell your providers, please select the right criteria, because we have a regional policy that if you select the ALS/BLS non-sick button, the hospital doesn't have to acknowledge it. It could just beep all day. So if you're bringing in a STEMI, a stroke, click that appropriate button. If you need resources, click the critically ill button. There's a red button on there that you could hit. Or if you need other resources like security at the door, it's always helpful to let us know, and it's better than better for the hospital, because they could plan ahead, and it comes in with more detail than just a simple phone call. So, we got 79 trauma notifications, 13 STEMI notifications, 101 stroke notifications. And then, so far for, 2026, only 12 EMS notifications were not acknowledged by the hospital. That's really it. That's all. That's the soapbox for now. Any questions about E-Bridge? Back to you.
Thanks, Doc. Okay, so the Nassau EMS redesign tag still on hold. However, the state is coming down with its guidance as to what the regions have to start putting together. That's Don, was that supposed to be in the next couple of months that they're looking for that, right?
Yeah, there's some, what's called chapter amendments, which goes back to the legislation after the governor's signature. The legislature, rather, the Senate, the Assembly, for some further actions once those are codified. Coordinators associate the SEMSCO will release some guidance documents to start those conversations. Speculated, although unknown right now until we see the chapter amendments, is to push off the implementation timeframe. So we'll have a little bit more time to work as well as.
Okay, so we'll stay on top of that. Keep everyone, yeah, we'll keep everyone posted. Oh, the RTAC meeting is on February 25th, and Don and I will both attend that, and we'll report back at the next meeting if anything comes up from RTAC. Online medical control,
No me.
no report, okay. Whole blood tag, Dr. Politi is excused today. He was unable to make it. He did email me his report. Basically, he just wanted everyone to know that we've been monitoring this, the policies and procedures coming from the state regarding pre-hospital blood. We've been reviewing literature, and also been looking into how other agencies are doing it across the country, and that he is planning for another meeting of the tag within the next few weeks. And then we will report back accordingly. Currently, that tag is me, Dr. Ryan, Dr. Politi, and Cole D'Arienzo. If anyone else would like to join that tag, just please reach out to Dr. Politi and to Don through Remsco, just so we're aware, and we're looking for more people to join. So if anyone's interested in joining that, please let Dr. Politi know or let us know, and we'll relay it to Dr. Politi. Any questions on that? Implementation wise, probably still a year or two out or more. So we have time to work on that and tailor it properly for our region. That's really going to be the important part about that. Everyone kind of seems to agree across the country that this is the thing. Like every, basically every group I'm a member of, ASAP, IACP, and TOA, I think, NAMSP, right? They were talking about the recent meeting, whole blood, all that kind of stuff. So this is the hot topic in EMS right now. So we'll definitely make sure that we're representing properly. And TC, yeah. So we'll definitely make sure that we're properly representing our region on that. Remsco chair, I think,
Will the Remsco chair?
Yeah.
He has no report.
okay, thank you. All right, and then Nassau EMS coordinator, Don Hudson.
Progress, like you say, state meetings are the end of this month. We're waiting on state guidance for county EMS plans as we discuss them.
Okay. More to come.
More to come.
Okay, for unfinished business, I think Dr. Harris is not here. He was out of the country recently, but we still have the PSAP tag with Dr. Harris, so we'll follow back up with that with him. As Dr. Kugler mentioned, the Kepler pilot project is with the SEMSCO, the CMAC, sorry, with the CMAC. And Dr. Winslow, who also sits on REMAC, he's heading that up with Cole and our team there. And then once we have the approval from the CMAC, then we'll have a pilot, anyone interested. So similar to the way we did the iGel pilot, there'll be a Kepler pilot, and we'll make sure everyone knows about that and can participate. And again, that's for using Kepler for status epilepticus, so basically multiple seizures. Midazolam will be given, but then that will be given as a secondary drug to try to prevent recurrent seizures. That's the idea. And we have a lot of support from that, from the various health systems and this neurologist that we've talked about. Anything else in unfinished that I'm missing? I think so. All right. All right, for new business, I'm gonna come back to the Long Beach ED guidelines in a second. I'll just go through the secondary, the seconded motions first, if that's okay, from Airway for everybody. So the first seconded motion from Airway is approving the Hicksville Fire Department, which is Dr. Zito's agency, as an RSI agency. Everyone's okay with that? Any opposed? Okay, passed unanimously. All right, the next seconded motion is the new RSI providers. That is Sal Farrow from Belmore Merrick, Bo Grafeo and Gabrielle Grafeo from New Hyde Park, Mike Kakish from New Hyde Park, and Delana Tran from New Hyde Park. We were just confirming one more piece of documentation on Gabby Grafeo, but I'm working on that with their agency. So as long as that's done, then we are asking for approval for all of them to be newly credentialed RSI providers. Everyone okay?
Second.
Come to the second motion, yep. Any opposed? All right, that'll pass. Oh, just so everyone knows, we did put a point of order on that, I missed a name on there, I'm sorry, Jeremy, I missed Jeremy, I'm sorry, Jeremy Bernstein, I'm sorry, there's supposed to be one more name on there, I apologize, Jeremy Bernstein, I apologize, he's with New Hyde Park, and he's with Point Lookout, so just, I'm amending that, I apologize. Everyone's okay with that? Jeremy Bernstein's in both agencies. He's in Point Lookout and he's in New Hyde Park. So as a point of order, if someone's approved as an RSI medic and they're in more than one agency, we are just going to make sure that the medical director of the other agency sends a letter so it's on the record that that person could also practice at their agency as an RSI provider. They don't have to go through the whole entire paperwork, but that just confirms that we're tracking that properly and that all the doctors are communicating. So that letter will be filed by me and that should be taken care of. And then the last seconded motion is for approval for BLS Superglottic Airway for Syosset Fire Department, South Farmingdale Fire Department, Hewlett Fire Department, and North Belmore Fire Department. It comes as a seconded motion. Everyone okay? Any opposed? Okay, that passes, Jim. All right, for the other new business, so when Long Beach, so I'm bringing this forward on behalf of Mount Sinai and my other hat. When Long Beach Standalone Emergency Department was opened in 2015, right after Hurricane Sandy, there was a REMAC advisory that came out as to which patients can be taken there. So this was the agreement that the hospital system had with New York State DOH. This was part of the policy manual. Somehow between 2015 and now, it was no longer part of the policy manual. We're not sure when it dropped out. This hasn't really changed at all, but recently there's been an increase in patients going there that really shouldn't be going there because it's a standalone ER and it's not able to handle certain patients. So basically, the 9 points on this are trauma patients, STEMI patients, stroke patients, burn patients, someone in active labor and delivery, violent behavioral health, psychiatric patients, violent intox, anyone that's requiring prolonged ventilation, like a chronic vent, hip fractures and dislocations and other unstable joint injuries, and then severe GI bleeding. If it's all right with everybody, I would like to put a motion forward that we just reissue this. I don't want to change anything for this. This really doesn't change what they've been doing. It's just there's a lot of awareness that's not happening because it's no longer there. Go ahead, Dr. Kugler. Okay, so by Dr. Kugler, seconded by Dr. Mulbauer. Everyone's okay with that? I'm just going to reissue it exactly as it is here, just so that way for awareness.
We'll
Yeah.
add that to the policy.
Yeah, we'll just add it to the policy.
Hospital
Yep.
section.
Yep, you got it. Okay. Anyone opposed? Okay, approved. Thank you very much, everybody. And then,
So just, if memory serves me, so if you remember back then, those that have been around the REMSCO and REMAC. So back then, there was two separate manuals complementary to the protocols, so arguably 3 sets of books. There was the REMAC stuff, which was separate, distinct from the REMSCO stuff, which was separate and distinct from the protocols. In around 2017, when we went to the collaboratives during that transition, give or take, everything was put into one regional manual, and it seems like at the time that was removed. Memory serves me, I think the intent was, well, they have ambulances there, they can ship anyone really sick out, but good patient care and a reevaluation of
Yeah.
that. We can do better, so let's reissue it.
Yep.
Cool, thank you.
thank you, I appreciate that. And then, as I mentioned, that we had 100% compliance with all the medical director and annual survey forms, so no actions required there. Thank you, everybody, for participating. And I'll have the floor open for any other new business. Okay, motion to adjourn. Anybody? Dr. Hassett? Second? All right, Dr. Mulbauer, all right. Well, thank you, everybody. Appreciate you.